right. Hi, everyone. My name is Krista, and we are excited to talk to you guys a little bit about genetic testing today. Again, my name is Krista Schatz. I'm a genetic counselor at Johns Hopkins. I work in the Department of Genetic Medicine, and part of my role is also working in the neurogenetics clinics, specifically epilepsy. And I work with Dr. Christa Habela, who is also joining us today. So I will turn it over to her.
Today we're here also with Tristin. She is a mother and is going to share her experience with us as well.
So, my name's Tristin West, and I'm a mother and a caregiver. I have two children, and both of them have neurological and genetic conditions that are different. And my son, Jason, is 11 years old, and he's very medically complex and nonverbal, has intellectual and physical disabilities. And I'll be sharing a little bit of his story today and our journey with genetic testing. It started when I was pregnant. I had no idea that there was anything wrong. And after he was born, he looked a little different. So doctors, I didn't even have a clue. They had done blood tests to test for Down syndrome and the trisomies and do that in this initial diagnostic testing. I just remember being really tired and early in the morning, and they came back and said everything was normal. I'm like, well, thank goodness. I had no idea you were testing for anything. And after we went home and had a few hospitalizations, we started discovering his different medical complexities, and genetics got involved in patient, and we ran the microarray test, and that came back normal, and we didn't have answers there. And things just got harder. There were more surgeries, more hospitalizations, more illnesses. And I was really determined to do all that I could to get answers. So I pursued additional genetic testing. And I remember our geneticist told me only 49% of children get diagnosed, and he wanted to know why it was so important to me to get a diagnosis. And I felt confident that a diagnosis would affect my son's medical care and treatments. And I know that's not the case for everyone, but that's just my mom instinct that told me we were missing something. And I know there's various reasons why parents and clinicians want to pursue genetic testing. Dr. Krista, what are some of the reasons that you are aware of?
Well, I think, your statement that you thought it would affect your son's care is absolutely correct. Genetic testing should really be considered part of standard diagnostic evaluations for our children with neurologic disorders, specifically those with epilepsy. It's really important to in order to provide the providers with a deeper understanding of what is going on with their patients, so that they can potentially give more targeted treatments. It can also give insight into long-term outcomes or risk of involvement of other organ systems besides the brain. And then certain diagnoses have disease-specific treatments. Alongside of that, with my experience with families, is that it really does, there is something meaningful in understanding why their child or why their loved family member is going through the all of the difficulties that they are going through. And in the era of social media and social networks, it provides potentially connection with other groups of children and groups of families that may have more knowledge about the disorder than their doctors do. The next question that a lot of people ask, and it sounds like you started this really early on in terms of starting the investigation, but didn't get to an answer until quite a bit later, is really, when should we consider genetic testing? And I'm going to send that over to Krista.
All right, thanks. So I mean, genetic testing can really be done at any age. There's no age limit on when someone's allowed to have genetic testing, including adulthood. We're seeing a lot more referrals for adults now just because the genetic testing wasn't available when they were younger. But if possible, earlier is better, because if there's a change in medical management based on the diagnosis, we and the families, like you said, Tristin, would want to know that as soon as possible so we can make the appropriate interventions. But also, if there's no change in medical management, I think families and providers want to know that as well. In general, and this is painting with a broad brush, but younger ages of onset of symptoms and more severe presentations tend to have a higher chance for diagnoses, but there are many, many exceptions to this rule, which is why we say there's no limit based on age or presentation. Tristin, when you were deciding to pursue genetic testing, it's such a broad area. What sort of questions did you have?
Well, I know I was really confused about the different types and levels of testing. Like when they first were testing Jason and I didn't even know, and they said, oh, everything's all good and normal. I thought that was that. And he was able to go home with me from the hospital. And so I thought everything was okay. And clearly we started having some different troubles, some health problems, and he was in the hospital a lot. And then that's when we learned about microarray testing. And even though I was fortunate enough to get a consult pretty early on with genetics because we were inpatient, I didn't understand what that meant. I thought, okay, well, now this is the big test. So this will tell us what's going on with Jason. And then it came back normal. And so once again, I thought, woo, dodged that bullet. We're good. He just must have some random health problems, and we'll be good. And it wasn't until I met with genetics again later that I learned that there were other levels of testing, like panel testing. And I came to an appointment with our geneticist. I did a bunch of research and I found different syndromes that I thought were possible syndromes because of how he looked and the different conditions he had and presentations. And I was just thinking, hey, we can just run a test for these if the doctor's thinking that some of these are possible. And that's when he explained to me, well, those would be often on panel testing. And when all of these are possibilities, then what we need is whole exome sequencing. And so that was big and new to me. And then years later, as I learned from medical conferences I went to for families and clinicians, I learned about whole genome sequencing. It feels really overwhelming. It still does. And I wasn't always sure what type of testing to advocate for, to expect next, what's actually possible, what insurance will cover, and what's affordable in the long run. I just didn't know what the best course was. And I wish I would have had a better idea early on, and like a little intro to genetics, and these are the different types of tests, and this is kind of the path we follow.
Yeah. And that's really hard. You bring up some really good points and things that I think a lot of families and non-genetics providers struggle with, because there's so many different tests and each test is able to detect certain things but also has its own limitations. There's no one test that can test for everything possible, and sometimes I feel like families are wondering, how many other tests could you possibly offer? Because just like you, they think we did that test, phew, we're done, and then there's another one that you can consider. I think you mentioned in general the most common tests, like the microarray, which is almost like a snapshot of the chromosomes where we can look for large missing or extra pieces of DNA. But then there's the gene panel, which usually has a very specific number of genes. It looks in detail at them, but they're very focused on certain symptoms often. So like an epilepsy gene panel or a hearing loss gene panel. And then there's the broader testing that you talked about, whole exome sequencing and whole genome sequencing. And again, those are much broader and they look for variants in most of the genes that we understand. But still, all of those tests have significant limitations. The insurance reimbursement can be different. And which specific tests to order often depends on that specific person's situation. So what's also difficult is there is not usually one route that we can tell people to take. That child or person needs to be evaluated by the appropriate physician and provider, and then we can decide on the appropriate testing to order. If you guys are interested in looking, the information will be in the notes section, but CNF has a really nice one-pager that describes different types of tests, potential costs, and benefits of genetic testing. Dr. Krista, did I leave anything out that you can think of?
I think that's pretty comprehensive. But one thing I just wanted to touch on a little bit that Tristin already touched on was that they did the big test. And so oftentimes we say, well, if the testing is negative, then we say it's not, or we our brains won't immediately say, oh, it's not a genetic problem. But we always have to remember that the tests that we're using are the best tests that we have today. And the best tests that we have today may not be the best test that we have tomorrow. And so sometimes even patients who have had genetic testing, we need to go back and revisit that testing with the most up-to-date testing that is available. And a negative genetic test doesn't necessarily mean that it's not a genetic problem. And you have sort of started talking about your journey, Tristin. How did you eventually get to your diagnosis, and how did you eventually get the testing that you needed in order to get that diagnosis?
It was quite challenging, which I think there's a bunch of challenges that families can face. When we went to our geneticist and he had determined that panels weren't the way to go, we needed whole exome sequencing. He sent off a pre-authorization for our insurance. And as most insurance in our state did at that time, they denied our request for testing. We thought that he would appeal, but he had told us instead of appealing, let's wait 3 to 5 years and see what advances in technology and testing we get. So just like what Dr. Krista said, what tests might be available tomorrow that we don't have today. And perhaps insurance will cover whole exome sequencing down the road. That sounds well and good and logical, but as a parent, I didn't want to wait. My son was already 2 and was having all of these health complications and surgeries. And like I mentioned before, I just felt like there were things that were missing that if we could get some answers, it might tell us more. I happened to be advocating at our state capitol and telling our story. And another parent came and met with me afterward and said, hey, I was in your shoes. And our insurance denied testing too. And I was able to reach out to a specific lab and talk to them and tell them that we were denied. And they said that they have a patient pay program. And in addition to that, they had financial assistance. And she said that they help all families in one way or another. So income was not necessarily the deciding factor, and that we should reach out to them. And I was concerned because I thought, well, how am I going to get back into my geneticist? He says follow up in 3 to 5 years. And she said, you know what? The pediatrician can just fill out the order and send it in. And then you go to the lab and do your blood work and send them medical records, and that's it. And it really was as simple as that. We contacted the lab. They were actually at a little conference we were at, and they gave me the kit right there to do our testing. And we went to the lab, and within 4 months we had our whole exome sequencing results, and we were not in debt for testing at all. I was shocked. And whenever I meet other parents, that's one of the first things that I tell them when they're talking about genetic testing and the challenges, especially financial challenges, is reach out to individual laboratories. And as time goes on, there's more and more of those available too. And they have different programs. And if one lab can't help, another one might be able to. So I highly recommend that families look out to the labs and reach out to them to see what options they have, and they can possibly move forward with testing a lot sooner than they're being told by a geneticist or by insurance. Sometimes as parents, we got to take matters into our own hands.
Yeah, I think that's a really important point, that it can be complex it can be difficult to try to get the genetic testing, but it can be done. And hopefully it's a little bit easier now than it was then. And hopefully, starting with our pediatric neurologists, our epileptologists, they can make that journey a little bit easier for families like yours. One thing that I think should help is that, up until the last year or so, it was generally accepted that all treatment refractory patients with epilepsy or patients with epilepsy and intellectual disability or other congenital malformations should have genetic testing, but it was a little bit unclear about what type of genetic testing should be done, and that made it harder for physicians and genetic counselors and families to make a case to insurance companies about what testing should be done and when. And now, within the past year, we actually have um, a consensus statement from the National Society of Genetic Counselors that says all patients with epilepsy should have genetic testing. And even beyond that, it says that that first line should be exome or genome, and if not possible, a large gene panel. And my hope is that one benefit of that is that if there are general recommendations that we should be doing this testing, that people like yourself don't have to fight that hard to get the testing that they need. One downside of that, though, is that with more and more testing being done, we come up to resources. And where do you find a genetic counselor? Where do you find a, a, a neurologist or an epileptologist that will help you get through that testing? Did you want to speak a little bit more about that?
Yeah, yeah, those are some of the challenges that I think families experience, that I experienced, and that others are still experiencing now. Um, Testing is expensive, and it's not always covered by insurance. And a lot of families think, okay, well, if I have Medicaid, then that will help. But each state's Medicaid is different and will cover different testings under different conditions. And we're learning that a lot of families that live in more rural areas, it makes it harder for them to get referrals or to see those specialists and geneticists. And there is a, often a longer wait for certain hospitals. For us in Utah, I was told there was a 1 to 2 year wait to see a geneticist for the first time. And then after we saw one, that it was usually 3 to 5 years later that you followed up to see if there was anything else that we could look for. And that can even be slower if the families in rural areas do not have a variety of specialists to see, such as the neurologist. There's also costs associated with seeing the specialists that can be challenging for families, or that they need to travel to get to these specialists. One of the things that I often think about, there's so much paperwork involved with everything in the medical world, and it feels very overwhelming to me. And when I'm in doctors' offices and learning new things about conditions and especially genetics, it's very difficult to understand. And I think, I'm a native English speaker. I am educated. How challenging must this be for other families where English is their second language, or they're still learning English, or in families where maybe literacy is a challenge? There's a lot of reading that I do, and it's hard. It's hard to understand. So if it's this hard for me, I'm often thinking, how hard is this for so many other families? And um oh, and then I loved what you said about not everyone has access to a genetic counselor. So that's for part of what I struggled with at the beginning, was knowing how to use my genetic counselor. And now I probably use her a little too much because she's a great resource. But at the beginning, I didn't know what her role was, and I I I could have utilized that resource a lot better, but not everyone even has a genetic counselor. So genetic counselors are great for helping be I think of them as like a liaison between the doctor and the family, and they really help you understand the process and what the testing means. And so if you go off and get your own testing like we did, it's challenging to then decipher what those results are and what they mean and what that means for a diagnosis or family planning or who carries what gene mutations in the family. And genetic counselors are the ones that can really help with that. Why else, Krista, you're a genetic counselor. Why else do you think it's important for families to see genetic counselors?
So I love all of those points that you made, and I feel like I could go on forever about why I think genetic counseling is important, but you've highlighted a lot of them. And there is technically an official definition of what genetic counselors do, but to summarize it, because it's a mouthful, is that it is a process and it's composed of helping people with the medical, psychological, and familial applications that go along with genetic disease. And so I think that really describes it. Medical. So we're part of the medical team. We're not the only person, but we're part of a medical team. And we're often the ones that help coordinate genetic testing for people. And part of this can include upfront providing informed consent, which can include setting appropriate expectations, debunking some myths about genetic testing, um, and just making people aware of the limitations of genetic testing that a lot of times they don't even know exist. And then also, in addition to helping get access to genetic testing, we also play such an important role with psychological and familial implications. So a lot of times when people have a child with a rare condition, nobody's ever heard of it before. So other doctors haven't heard of it, friends haven't heard of it, and even that family hadn't heard of it before their child was diagnosed. So we can help, as you said, be used as a resource to help navigate this really complex world. We can help provide resources. We can help connect families to one another. We can try to find other expert physicians. We can try to help families talk to their family members about what this would mean for them, if anything, and help explain things. So while we are often part of the team that's trying to help obtain a diagnosis, and maybe are the ones explaining the diagnosis, even if a specific genetic diagnosis is not made, we can still help support families on this journey that they're on, which can oftentimes feel isolating for people. So I love that you said we can be used as a resource, because that's exactly how I think of us. And so, Tristin, you had talked about genetic testing and maybe finding genetic counselors. Like, how did you ultimately find your genetic counselor?
I got my genetic counselor through our geneticist, and it took our journey to get to our geneticist that we're connected with now was not easy in itself. That we had seen someone inpatient, and then we were assigned a particular geneticist, and then that geneticist was not the right one for us to see. And so it took a while for us to get where we needed to be, and then even longer for me to realize what her role was and how she could help. And even now that we have a diagnosis, she's still a great resource. And she also uses families such as mine to help share stories and connect other people. So she does a lot to try and help the whole rare community, really. And you mentioned a lot about different resources, and I'm sure these are some of the resources that genetic counselors can also help with. But when I'm speaking with families, they're often asking about the financial resources that are available. And I recently did a simple Google search, and I got a list of labs that came up that already offer financial assistance. And I'm personally aware of some that weren't even on that list. So that's a good place to start if insurance companies are denying testing. There's also some national organizations for genetic and rare conditions such as NORD and Global Genes. And they offer programs to help with costs of medication and testing. And They also offer support and connections with others with rare diagnoses. There's also a national network of regions that support families, patients, and practitioners, and they're in designated regions across the United States. They have a lot of resources. My area is the Mountain States region, for example, and they have genetic navigators, ambassadors, webinars, genetic pop-ups. I have learned more the last couple of years from my experiences with them than I have in my whole 11 years. So that's been a wonderful resource. There's also foundations in the national community that you can look into that will help with the costs of travel to see specialists, medical bills, your copays associated with testing, and when testing is denied. And there's often foundations related to specific diagnoses, like if you know you have epilepsy or certain neurological conditions, heart conditions, cancer. They often have foundations that can help in those specific areas. And one resource that really helped us in our situation with my daughter was a local organization. So we have a couple in Utah that are local organizations that have different purposes. And one of them is to help with medical expenses, including genetic testing. And so that was a great resource for us. Also, your doctors, talk with all of your doctors, and if there's one that doesn't have an answer, ask another. It My daughter ended up having a different neurologist, and we had a completely different experience compared to my son. And genetic testing was so easy. It was just basically handed to us in the appointments, and she's an easier case, and we were able to do some panel testing and a copay of $100, and it was really simple. So had we not talked to a variety of doctors, we would not have known that. The last thing I want to suggest is that use your community and use your resources, like tell your story. Oftentimes, newspapers are really happy, news stations are happy to share stories about families with rare diagnoses and all that they're going through. And sometimes by sharing your story, you get connected with some amazing resources. So don't be afraid to ask for help or to share your story, because you can get connected with somebody that can help. I've also learned that primary care doctors and pediatricians can order all different types of tests and levels of testing, but not all of them feel comfortable doing that or know how. Dr. Krista, are there resources out there for clinicians so that they can help their patients get tested and get answers?
Yeah, many different organizations offer continuing medical education applicable to genetic testing. So the National Genomics Research Institute and the Jackson Labs have web-based tutorials. The American Epilepsy Society and the Child Neurology Society all have continuing medical education at their annual meetings related to genetic testing. And soon we'll have some online resources as well.
Excellent. And I failed to mention that the resources that I was mentioning will have some links provided to you on the website so that you can explore some of those specific resources. I really, really want to thank Dr. Krista and Krista, the genetic counselor, for meeting with us today and sharing their knowledge and expertise. This would have been a fantastic resource for me 11 years ago. I would have learned a lot from it. And I know this information that you are sharing will help families and clinicians in better understanding genetic testing. And I don't doubt that there's going to be families that get answers because of our conversations today. So thank you.
Thank
Thank
you.
you for sharing your story.